Hi, my name is Dr. Paul Williams, and I'm the president of the American Academy of Allergy, Asthma, and Immunology. I live in the Seattle area and practice in the Seattle area at the University of Washington. Sort of the big news coming out of this meeting is related to food allergy and the recent licensing or approval by the FDA of a particular biologic therapy for older children and adults with food allergy. It's called omalizumab. It's a real mouthful. It's been approved in the past for allergic asthma and for chronic urticaria or hives, as well as rhinosinusitis with nasal polyps. So it already has been approved for all those uses, but this is a new approval. So it's an alternative. There's avoidance, there's oral immunotherapy for peanut allergy, which carries risks of anaphylaxis. And there's this treatment, but it's an expensive treatment, so we don't know how it will work in people with regular insurance and be able to use that. But for people who are having trouble with avoidance and are particularly anxious about their food allergy, and that's certainly quite a few people with severe peanut allergy, then it's really a way to make their lives a lot better. One of the other important themes that actually will carry over into next year's meeting is the influence of our microbiome on allergic disease, how it affects the gut, the immune system, the respiratory symptom, and the skin. They're really doing a lot more research on the microbiome and trying to identify organisms that are responsible for the potential good effects and bad effects of the bugs in your gut, as the saying goes. So every president of the Academy has what are called initiatives that they announce at the onset of their service, of their office. And mine, and that also relates, as it turns out, to the topic of the annual meeting next year, which will be the impact of the environment and climate change on allergic disease. And that's going to be one of the foci of my initiatives for this next year. So education for our allergist members on specifics of environmental impact and climate change, on things such as wildfire and changes in pollen, changes in insect vectors, changes in bacterial and other infectious complications that are all impacted by climate change.
I'm Jonathan Witansky. I'm assistant professor in the Division of Pediatric Allergy, Immunology, and Bone Marrow Transplant at the University of California in San Francisco, where my research primarily focuses on social, environmental, and genetic determinants of asthma and allergies. We've known for quite some time, probably over 2 decades, that being enrolled in daycare at a young age is actually protective against asthma and allergies. And one thing that's very unique about a project that I'm fortunate to be a part of, a project called Primero. It's a prospective longitudinal study where we recruited our first mothers to participate, pregnant mothers, in March of 2020, when we had our first expectant mother recruited into the study. And between March of 2020 through June of 2023, we completed enrollment of 2,100 healthy term infants. And over their first 2 years of life, through close surveillance, regularly emailing or texting these parents to assess for any respiratory illnesses, and when they have one, especially one that is affecting their lower respiratory tract, we have them come into one of our collaborators' clinics in Caguas, Puerto Rico, where they get fully evaluated and also have nasal swabs collected to look at the viral determinants of those illnesses and look at transcriptomic changes potentially related to those illnesses. In addition, at birth, we're collecting blood from both the mother and the infant for genetic studies. At year 2 of life, we're collecting blood again from the children to look at complete blood counts, to look at total IgE levels, look at sensitivities to various environmental and food allergens. And actually, the research that I conducted was primarily looking at the allergy and total IgE testing based on those samples collected at year 2 of life. Our findings is that there is a fairly significant increase of odds of having a respiratory illness, both upper and lower respiratory tract involvement for children who attend daycare. And this is adjusting for many factors. For example, having other kids in the home where the child is living, the child's age, the child's sex, the child's race, factors about the mother, such as her age at time of giving birth, the mother's educational level. We also found that total IgE levels are lower for children who attend daycare compared to children who do not. But interestingly, we're only seeing that finding if the child attended daycare in their first year of life. If they attended later, for example, in the second year of life, we're not seeing that the same association. And then finally, specific IgE testing to evaluate for food and perennial aeroallergen sensitization. We're seeing a decreased odds of having those sensitizations among children who attended daycare relative to children who do not. I think one of the first issues that we need to really just explore is the mechanism that underlies this, because we're always seeking early interventions to lessen allergies and asthma in children, which, if anything, are growing in prevalence. Would it be safe to say that daycare in of itself is a early intervention that can have that effect? Perhaps too soon to say in terms of this Primero cohort. Although with that said, I think it can inform the guidance that we provide parents who are perhaps concerned about sending their children to daycare, given the increased rates of respiratory illnesses that they will almost certainly have in that setting, that those respiratory illnesses do not seem to necessarily contribute to this relationship. And if they do, a very small amount.